Hi, I'm Dr. Kelly Harding at Columbia University Medical Center, and we are here with Dr. Arthur Barsky from Harvard Medical School and Dr. Brian Fallon from Columbia's College of Physicians and Surgeons. And we are doing a series of segments on hypochondriasis, both the diagnosis and treatment. This segment is actually on the I guess the etiology of hypochondriasis, or what are the causes of hypochondriasis. So with that in mind, I will go ahead and ask, what would cause somebody to all of a sudden develop a lot of worry about their health?
Want to start?
Sure. It can often be a whole series of stressful events, that some of which may be obviously major life events, like somebody has a threat to their physical health, or someone in the family, someone they're close to, really gets sick. Or sometimes they're relatively minor stresses, but things that are very meaningful for the individual. So, for example, a common situation we see would be a relatively young man whose father died prematurely, let's say of heart disease. When he reaches the same birthday that his father died, will begin to wonder if maybe he ought not have his heart checked, whether he's having a little bit of pain on exertion. So sometimes it can be a relatively minor event that has a lot of meaning for the person, an anniversary reaction of the death of someone, for example. And also, as we mentioned in one of the other segments, things like an anxiety attack can sometimes trigger it. People who have an anxiety attack very characteristically start to worry about what might be causing that. Maybe there really is something wrong with their heart, having trouble breathing.
Oh, sure. Anxiety attacks, often people end up in the emergency room because they think they're dying.
Exactly. Yeah, exactly.
I think also if work gets too stressful, if your work suddenly becomes extremely stressful and you're not the type of person to express your emotions verbally, it might actually come out in your body, and you might suddenly find that your GI system is acting up and you have diarrhea, or you might find that your heart starts to beat fast. And it's really stress, but you're not aware of it. So then you start to worry that, oh my gosh, maybe I have developed Crohn's disease, or I have cancer in my GI tract, and instead of realizing that the real source of stress is the work.
So stress can cause not only mental distress, but also
Oh,
physical
absolutely.
symptoms.
That's a great point, because a lot of patients do not realize that the body expresses emotions and physical symptoms that are very physical, like heart beating fast, lightheadedness, dizziness, feelings of flushness, whatever it is in the body, tightness in the muscles. Sometimes patients come in and they're worried that they have brain cancer, and you ask them why, and they say, well, because I know I have this tumor in brain because I can feel it. And then you tell them, well, brain, if you have a tumor, the brain tissue itself can't feel it. Well, that doesn't make any sense to them, because they have pain in their head, but they often have pain right in the back of the head, and that's where the muscles from the paraspinal muscles come up along the spine. They attach to the back of the head, and when you're tense and anxious, it tightens up, and you have this searing pain, burning pain in the back of your head, and then it can extend across. That stress. It's physical, but it's stress.
Dr. Barsky, did you want to add anything to that? It sounds like you were talking about earlier that a lot of times symptoms don't always. A lot of healthy, normal people have symptoms as well, but that sometimes people with high anxiety fear that they're actually indicative of a serious disease.
Yeah, that seems to be often what starts the hypochondriasis off, which is that somebody will take a symptom that they've had for maybe a long time on and off and never thought much about it. And then something will happen in their lives to make them think that maybe this is something serious. Maybe it's not just normal. Maybe something's really wrong. Because for the most part, most of us normalize symptoms. In other words, we notice something's bothering us. You're a little breathless when you climb the stairs, or a little dizzy when you stand up rapidly. But we say that it's just getting old, it's being out of shape, it's not eating properly, it's the wear and tear of life. There are all sorts of ways to try to dismiss symptoms. But what will happen under the effect of one of the stresses that we've talked about is that hypochondriacal people will start to think, well, maybe that's not really normal. Maybe that's the symptom of a disease. So if you're breathless when you climb the stairs, instead of saying I'm out of shape, it becomes maybe I'm anemic, maybe I have asthma. And that often sets off this chain in which you start to look for other symptoms that fit with your suspicion that you're sick. And you can find them because of the kind of thing we talked about before. There are all these symptoms in daily life. And so you're breathless and you think maybe you're a little anemic. When you look in the mirror, you think that maybe you're kind of paler than you used to be. That sort of thing goes on all the time. You hear about a coworker who's developed leukemia, and then the fact that you lost a pound or two suddenly becomes significant, or that bruise on your thigh starts to become worrisome. And instead of thinking, well, maybe I bumped myself when I was doing something yesterday, it's, oh my God, maybe I've got leukemia too.
So mistaken understandings about symptoms and their significance can contribute to causing hypochondrias. Um, Learning from childhood can also do it. So, for example, if your mother jumped every time you had a symptom, uh, you might then learn that having a symptom is a helpful thing because I get more attention from my mother. And in fact, I have this very lovely dog who developed this horrific allergy as a pup and would scrape her head on the cement, and she actually abraded her eye at one point, and I thought, oh my gosh, this is awful. So my wife and I, whenever she went into one of her allergy fits, we would go running to stop her from scratching. And she learned that whenever she needs attention, she will throw her body again on the floor and start scratching. And this she does 10 years later. If she wants to go out and we're not paying attention, she'll throw her body down on the ground and start scratching. And it does cause us to go get her. It's not like she's doing it consciously, but she learned that this was a way to get the caring and the attention that she needs. And that's a dog, but we as humans learn the same thing from our parents. And if your mother or father happened to be someone who was, let's say, highly fearful and afraid of letting you go do things and imagined the worst possible consequences from the smallest ailment, you might have been dragged to the doctor for no reason. And, so you sort of learn that you need to be vigilant because your mother told you that you needed to be vigilant, or your father told you that you needed to be vigilant. So that's learning theory explanation as to why people might become hypochondriacal.
And there are lots of kind of daily examples of that as parents we're all familiar with. We really teach our kids how seriously to take a symptom. What's your threshold for taking your child to the pediatrician? What's your threshold for keeping your child home from school for a physical complaint? In doing that, we really are teaching our kids how alarmed to become, how much to catastrophize a symptom. And if you just think about it, there are 100 examples. But if your child comes down to breakfast and says that she doesn't want to go to school because she has a stomach ache, you may well let her stay home from school. But if she comes down to the breakfast table and says she doesn't want to go to school because she's afraid she's not going to do well on a math test she has that morning, you're going to make her go to school. So we really teach our kids how to express their concern, their distress, in ways that clearly are reflected throughout the rest of life. We essentially train them.
Yeah. So